America's healthcare system is being called a medical emergency by everyone from film producers to political leaders. Healthcare costs are rising at an annual rate of 7 to 9%, reaching a grand total of $1.6 trillion last year. And while we spend more on healthcare than any other country in the developed world, we also have more uninsured people. At least 47 million Americans have no health insurance at all, risking their own financial ruin and too often passing on their health care costs to those of us who do have insurance. Right now, more than 20 different plans have evolved in Congress, all hoping to cure this health care crisis. But among the varying political fabrics is one common thread. Something has to be done about our nation's health care system now more than ever. Here's our Jessica Betts.
It's affecting every single one of us, and access to it can ultimately determine whether we live or die. Healthcare is a hot and heavy issue and in the national spotlight like never before. A study done by the Commonwealth Fund graded all 50 states on the performance of its healthcare system. Oklahoma and Mississippi tied for last place.
This is going to do your blood pressure and your pulse.
In rural Oklahoma, finding doctors willing to move to small towns is still a problem.
You know, there will always be a challenge, especially in rural areas, to have all of the access to care that you need. Rural areas are more challenging in all regards, of having not only nurses to staff the hospitals, but the appropriate number of physicians.
Dr. Mark Osborn of Miami says the challenges rural doctors are facing are far more than the challenges city doctors face.
You know, if you are in a group in the city, you may take call every 7th night or may have to take every 6th or 7th weekend. In rural settings, it can be as often as every other night, or in some cases where you're really isolated, you may be on call all the time.
You head back here and swing your feet up there.
Scott Glover is a medical student at Oklahoma State University's Center for Health Sciences in Tulsa. Thanks to the Physicians Manpower Training Rural Healthcare Scholarship, he hopes to lighten the medical load in rural areas.
A good deal. If you're wanting to stay in rural Oklahoma, it's a very good deal because they go ahead and they give you enough money to make, so instead of starving through medical school, you can take the physician manpower and have a little more money.
Can you take a deep breath for me?
Glover was awarded a $60,000 loan because he's an Oklahoma resident in a state medical school. Most importantly, he wants to give back to Oklahoma.
You know, Oklahoma says they want to keep their best and brightest. Well, you're investing in your best and brightest to keep them in the state before they even start to look to go out of state.
But the lack of medical staff in rural areas is only part of the problem.
We are overweight, we don't exercise enough, we smoke too much, and it's leading to a tremendous increase in diabetes and chronic diseases, heart disease, cancers in the American population. And actually, the situation is so bad now is that this generation of children may actually live less long than their parents and grandparents have, unless we reverse some of these problems that we have. When people complain about the cost of health care, you have to keep in mind that one thing that drives the high cost of health care is a lot of sick people. And so if you've got a lot of sick people seeking high cost medical care, obviously that's going to drive up the costs. So that's a big part of this also.
So big that America is moving towards health care reform, unlike we've ever seen before.